Hi, I'm Dr. Wolanski from Vancouver Island Implant Centre. This morning I want to share a video with you. I was just down in New Orleans at the ICOI convention and I was speaking to some dentists about a new handpiece that we're using. It's a phenomenal handpiece and this is what I'm going to demonstrate today. If you do any oral surgery in your office and you use something like an Impact Air 45, which I've used for years, I personally have always been frustrated with how little torque it has and how it stalls out. Very different than the oral surgery instruments and drives that run on nitrogen that have an amazing amount of torque and allow your work to progress quicker at a quicker pace. So I've had electric handpieces for years, used in Europe for many years. Many dentists have switched to electric drives now. If you're not using an electric handpiece, you really would want to look at it. It allows you to do finer work, better work, and quicker. The first handpieces that came out used to be really heavy and cumbersome. They would tend to heat in the head as well. The new ones don't do that. They're very light and well balanced. We've been using ours, I've had a couple of them. The one I'm using now is a Ti-Max 400, and it's a great handpiece, but the real improvement in it, I've been waiting for this for about 15 years, is to have a 45-degree head angle on it so that you can use it for oral surgery. And this is it right here. It's called, you can zoom in on that again. It is called the NSK Ti-Max Z45L with a gear ratio of 1 to 4.2. Now I'm going to demonstrate it. I'm going to first show you, I've just invested a couple of wisdom teeth which we previously sectioned in the surgery. I put them in some greenstone, some dye stone just to simulate the bone. And we're going to run first of all with the classic Impact Air 45. So, and you'll see the difference in time that it takes. When you see the difference, you'll know what I'm talking about. So here we go with this guy. So we're frothing. And we'll start sectioning the tooth. And you know what I mean when I tell you that the Impact Air stalls out. So and when it stalls out and takes a long time for your patient, that makes a procedure that's rather unpleasant longer for the patient. So again, the handpiece often stalls, low torque. I'm cutting without water just for demonstration purposes, of course. Still not quite through. There we go. So that's the Impact Air 45. It's been a workhorse for many dentists for many years. Now we're going to switch and we're going to use the electric drive handpiece. It has a beautiful, beautiful balance to it, very, very nice fiber optic light, and we're just going to go to it and you'll see the difference. Now, this is actually a bigger tooth than the other one. Done. So the torque in this handpiece is really amazing. When I use it, I had the biggest smile on my face. The other thing I will caution you about, especially if you're a younger practitioner or newer to oral surgeries, you have to be very, very cautious about using this handpiece. With the amount of torque it has, you can get to vital structures very quickly and accidentally. So you would have to be a little bit cautious when you're using it, go a little slow. But I hope this is something that you'll look into your practice. And trust me on this, it'll be one of the best mechanical equipment additions you can make to your office. Thanks.